Are you over 70 and still going for all the standard checkups your doctor recommends? Well, hold on a minute. Some of those routine tests might be doing you more harm than good. I know, it sounds crazy. But what if I told you that several screenings pushed on seniors today are not only outdated but could actually shorten your life? We're talking bone scans, brain MRIs, even heart tests, yes, the very things that are supposed to protect you. Today, I'm pulling back the curtain. Because when you're over 70, healthcare shouldn't be about fear or over-testing, it should be about freedom, clarity, and living well. So stay with me, because this might just change how you look at medicine, and your own health, for good. Welcome to the 60+ Health Hub, the place where seniors like you come to get real answers, without the medical jargon, without the scare tactics, and without feeling like you're just another number on a chart. If you're new here, I'm Dr. Max, and I've been in clinical practice for over 30 years, working directly with older adults to help them live longer, stronger, and smarter. I want you to know, you're in the right place. Here, we ask the tough questions. Here, we challenge the norms. And today's topic? It's a big one. Because if you've ever been told, it's just routine. But your gut told you something felt off, you weren't wrong. You see, medicine has a way of repeating itself. Once a test or procedure becomes standard, it gets repeated over and over, even when new evidence shows it might not be helping. And when you're 70 or older, your body changes. Your risk profile changes. Your needs change. Yet, most of the medical system is still treating you like you're 50. That's not just inefficient. It's dangerous. So in this video, I'm going to walk you through 5 routine health screenings that are often pushed on seniors, but can come with serious consequences. We're going to cover the risks no one talks about, the real science behind the tests, what to do instead to protect your health and autonomy. Let's dive into the first 2 that are quietly causing more harm than healing. 1. The bone density scan, DEXA scan. Why this routine test may lead to dangerous decisions. Let's start with one you've probably heard of, the DEXA scan. Short for dual energy X-ray absorptiometry, this test is used to measure bone density and diagnose osteoporosis. Sounds harmless, right? You lie on a table, they scan your hips and spine, and you get a number, your T-score. But here's the problem. Once you're past a certain age, especially 70 or 75, that number becomes less predictive than you think. Why? Because bone density doesn't tell the whole story. Let me explain. Imagine 2 women, both age 72. They get the same DEXA scan result, low bone density. One of them walks 2 miles a day, does yoga, eats calcium-rich foods, and has never fallen. The other one lives a sedentary life, has balance issues, and has fallen twice this year. According to the DEXA scan, they're both osteoporotic. But who do you think is at greater risk of breaking a hip? It's the second woman, not because of bone density, but because of real-world function, mobility, balance, nutrition, and fall risk. Now, here's where it gets dangerous. When older adults get flagged for osteoporosis based on this scan, they're often immediately put on medications like bisphosphonates, Fosamax, Boniva, Reclast. And those meds? They come with serious side effects. Jaw necrosis, yes, your jawbone literally dying. Spontaneous fractures. Esophageal irritation. Chronic pain. And in rare cases, heart rhythm abnormalities. Yet few doctors talk about this with their patients. Even worse, once the label osteoporosis is on your record, it follows you. It affects your insurance, your treatment, even your sense of safety. And many seniors begin to fear activity. Afraid their bones are too weak, when in reality, movement is what they need most. So what should you do instead? Here's my take. If you're over 70 and have no history of falls, stay active. Don't smoke or drink heavily. Eat well. Then reconsider the need for a DEXA scan. Instead, focus on fall prevention strategies, strength and balance exercises, regular vitamin D and calcium intake, home safety adjustments. That's real prevention. Not a scan. And certainly not a pill with a 5-page warning label. 2. The brain MRI, just to check. When imaging the brain creates more anxiety than answers. Next up, one of the most overordered tests in seniors, the brain MRI. Now don't get me wrong, brain imaging can be invaluable when you're dealing with a clear neurological issue. Sudden memory loss. Stroke symptoms. Severe confusion. Balance issues with no known cause. But more and more often, I see brain MRIs being ordered for patients over 70 with mild forgetfulness. The kind that's normal with age. The phrase I hear from patients is this: my doctor just wanted to check for anything concerning. But here's what happens. The scan comes back. And instead of nothing concerning, it shows something like mild white matter changes, small vessel ischemic disease, brain atrophy consistent with age. Now suddenly, you're panicking. You think you have dementia. You feel broken. You start worrying every time you misplace your keys. But here's the truth. Almost every adult over 70 has these changes. They're like gray hairs or wrinkles, part of the aging process. The MRI doesn't tell you how you think, how you function, or what kind of life you're living. But once that finding is on paper, it changes how your doctor treats you. It may even affect how your family treats you. In some cases, it leads to additional, unnecessary testing. PET scans. Cognitive batteries. Appointments with specialists. All of which come with stress, cost, and emotional burden. What's worse? There's no treatment for most of these findings. It's just something to monitor. So here's my advice. If you're over 70 and your memory is generally stable, no rapid changes, no big concerns, skip the scan. Instead, prioritize brain-healthy habits. Social connection. Daily walking. Omega-3s. Lifelong learning. Proper sleep. Do memory games, read books, play music, engage your brain in joyful ways. Ask your doctor about a clinical evaluation, not imaging. Because MRIs can't measure joy. or engagement, or mental resilience. And those are the real signs of a thriving brain. We've just scratched the surface, and already you can see. Some tests might sound helpful, but in the real world, they carry hidden risks. But we're not done. In the next section, I'll show you how even heart tests and cancer screenings can be harmful past a certain age. I'll also tell you the truth about a popular early detection scan that may be doing more harm than good. Stick with me. Because you deserve real health, not just more appointments. Now, let's take a deeper look into the second checkup that might seem helpful on the surface, but could actually do more harm than good if not approached wisely. Let me talk to you about colonoscopies. Colonoscopies have long been considered the gold standard for detecting colon cancer. And yes, for many people in their 50s and 60s, it is a life-saving test. But here's where things get tricky, and where your age and overall health status start to matter more than just statistics. If you're over 70, especially in your mid to late 70s or 80s, you need to start thinking about risk versus reward very differently. Why? Because the colonoscopy itself isn't as harmless as people think. It's not just a quick test. It involves sedation. It involves a day or more of prep, which can lead to dehydration, fatigue, and even electrolyte imbalances. That might not be a big deal for a 55-year-old, but for a senior managing high blood pressure, heart issues, or mild kidney problems, it could push your body past a threshold it wasn't prepared for. I've seen it firsthand, patients who were relatively stable going in, but came out needing 4 fluids, suffering confusion, and in some cases, even ending up hospitalized from complications that didn't even come from the colonoscopy findings themselves. Now, does this mean you should never get a colonoscopy after 70? No, not at all. But here's what you should do instead. You sit down with your doctor and ask this one crucial question. Given my overall health and life expectancy, will this test change anything about how I live or how you treat me? If the answer is no, if finding something won't lead to treatment or improved quality of life, then maybe it's not the test you need right now. There are also non-invasive options today, like the FIT test and Cologuard. These don't require anesthesia or bowel prep. They're much easier on the body and still offer meaningful screening, especially if you're at average risk. So before signing up for a routine colonoscopy just because it's on the list, pause and consider whether it still serves your best interests at your current age and condition. Now let's move on to number 3 on the list. Routine PSA testing for prostate cancer. Gentlemen, this one is tricky, and I've had so many heartfelt conversations with patients about it. PSA stands for prostate-specific antigen. It's a simple blood test that can detect signs of prostate cancer. Seems harmless, right? Just one more tube of blood. But what happens after that blood test? That's where the risk begins. A slightly elevated PSA might lead to more tests, more anxiety, and in many cases, a prostate biopsy. That's not a minor procedure. It involves inserting a needle through the rectal wall to take samples of your prostate tissue. Painful? Often. Risky? Sometimes. Biopsies can lead to infection, bleeding, and even hospitalization in seniors whose immune systems aren't what they used to be. And here's the kicker. Most prostate cancers in older men grow so slowly, they'll never cause symptoms, much less kill them. That means many seniors end up being treated for a cancer that was never going to affect them, suffering the side effects of treatments like radiation and surgery, including urinary incontinence, erectile dysfunction, and fatigue, for something that might have never grown large enough to matter. So what do we do instead? We individualize. We don't automatically test every man over 70 with a PSA. Instead, we ask, do you have a strong family history of prostate cancer? Have you had abnormal urinary symptoms? What's your overall health and expected lifespan? If you're otherwise healthy, active, and have a good 10+ years ahead of you, then yes, a PSA might make sense. But if you're managing multiple chronic illnesses or have a shorter life expectancy, skipping that PSA might save you more stress than you think. Remember, medicine should be about quality of life, not just quantity of tests. Now, number 4, and this one will surprise a lot of people. Frequent full-body skin cancer screenings. I'm not saying you should ignore moles or strange skin changes. Not at all. But what I am saying is that full-body skin exams, where a dermatologist checks every inch of your skin regularly, may not be necessary for every older adult, especially if you've never had a skin cancer before or don't spend a lot of time outdoors anymore. Why? Because not every abnormal spot needs to be biopsied. In seniors, skin becomes thinner, more fragile. Biopsies, even small ones, can take longer to heal and carry a greater risk of infection. I've seen simple skin exams turn into a cascade of biopsies, some of which cause more harm than a minor lesion ever would have. So here's what I recommend. If you've had skin cancer before, absolutely keep up with regular checks. If you notice something new, a mole changing shape, color, or bleeding, definitely get it looked at. But don't feel pressured into full-body exams every 3 months unless there's a medical reason for it. Be proactive, but don't become a patient in pursuit of a problem that isn't there. We're almost at the end. But before we wrap part 2, let me share something I tell all my senior patients. You've spent decades taking care of others, now it's time to take care of yourself in a way that's not just about more appointments, more scans, more stress. It's about thoughtful care. Personalized care. Care that prioritizes your quality of life, your independence, your peace of mind. Now we come to one of the most misunderstood procedures that many seniors still undergo regularly: annual prostate screening via PSA testing. Checkup 4, PSA testing for prostate cancer. For most seniors, it does more harm than good. Let me say this clearly, I'm not against early cancer detection. Not by a long shot. But in older men, particularly those over 70, the PSA blood test often opens the door to a chain of unnecessary stress, misdiagnosis, invasive procedures, and even serious complications that never needed to happen. Here's why. The PSA test measures a protein in your blood called prostate-specific antigen. Elevated levels can sometimes indicate prostate cancer, yes. But they can also go up from benign conditions like an enlarged prostate or even just a recent bike ride or a bout of constipation. And what happens when the number is high? You're referred for a biopsy. And let me tell you, that biopsy is no small matter. It involves inserting needles through the rectum into the prostate. It carries a risk of infection, bleeding, and even urinary complications. Now let's say cancer is found. Well, prostate cancer in elderly men is often so slow-growing that it will never become a problem in their lifetime. But once the word cancer is mentioned, panic sets in. Suddenly, men are pushed toward aggressive treatments like radiation, hormone therapy, or surgery, each of which can cause lasting harm like incontinence, erectile dysfunction, and a dramatic decline in quality of life. And the kicker? For many of these men, doing absolutely nothing, or what we call active surveillance, would have been the safest and smartest option. So what should you do instead? If you're over 70 and have no urinary symptoms, think very carefully before agreeing to a PSA test. If your doctor insists, ask, how will this test help me live longer or better? Consider a second opinion. Ideally from a urologist who understands the risk/benefit balance for seniors. And most importantly, listen to your own instincts. You have every right to decline a test if it doesn't sit right with you. Because protecting your health means more than chasing numbers, it means protecting your peace of mind, your dignity, and your independence. Now, we've covered 4, but this last one. It may be the most dangerous of all. Let's talk about the 5th health checkup that might be harming seniors far more than helping. Checkup 5, cardiac stress tests in seniors without symptoms. This one hits close to home. A patient of mine, let's call him Mr. Collins, 76 years old, came in for a routine physical. No chest pain, no shortness of breath, walking daily, felt fine. But because of his age and a slightly elevated cholesterol level, another doctor recommended a nuclear cardiac stress test. Just to be safe, they said. It sounded harmless. But what followed? A borderline abnormal result, which triggered a CT angiogram. That turned into a heart catheterization. And within 2 weeks, Mr. Collins was on the operating table for a stent. A stent, for a man with no symptoms, no pain, and no limitation in daily life. The worst part? A few days later, he began having irregular heart rhythms, a direct result of the procedure, and ended up back in the ER. Now, let me explain why this happens. Stress tests in asymptomatic seniors often uncover incidental findings, minor blockages or perfusion defects that are clinically insignificant. But once something shows up on a scan, the medical machine revs up, and suddenly, you're getting procedures that carry serious risks. These include bleeding, arrhythmias, kidney damage from contrast dye, and in some rare cases, even heart attack or stroke. For a senior who had no symptoms to begin with. So what do I advise instead? If you have no chest pain, breathlessness, or exercise limitation, skip the stress test unless your doctor has strong reasons backed by clear evidence. Discuss your heart disease risk with tools like the ASCVD risk calculator, not just scans. Focus on lifestyle, blood pressure control, walking daily, eating well, avoiding smoking, and managing stress. These are what really protect your heart. And remember this truth, not every abnormality needs to be fixed. Especially not in people feeling well. We need to stop the mindset that every senior needs to go through a medical car wash just because they're over 70. You're not a number. You're not a lab value. You're a whole person with a history, feelings, preferences, and the right to say no. This isn't right for me. Let me close this out by bringing it all together. Overtesting, overtreatment, and blind obedience to protocols can sometimes do more harm than good, especially in the later years of life when quality matters more than quantity. Here's what I urge every senior and every family member to remember. Always ask, how will this test improve my life or protect my health? Never be afraid to get a second opinion. Learn the difference between evidence-based care and fear-driven intervention. And most of all, trust your gut. You've lived long enough to know when something doesn't feel right. Don't let the white coat blind you. You have the wisdom, and you have the right, to choose what's best for you. This is Dr. Max, and I thank you for spending this time with me. If this message resonated with you, please like, subscribe and share it with someone you love. You might just save them from an unnecessary test, or a lifetime of consequences. Stay informed. Stay empowered. And I'll see you in the next one.